This is how you do a C-section. Patients on the table, make sure they're numb. You clean off their belly, you put up a drape, you check to make sure they're numb again. You use a knife, you make a 10-centimeter skin incision down at the bikini line. Goes through the skin, goes through the fat, you get all the way down to the fascia. Then you use another knife, you make a little hole in the fascia on both sides. And you take scissors and you cut up the fascia in both directions. And then you pull a little bit. Then you use coker clamps to grab onto the fascia, lift it up, push down or cut off all the tissue underneath it so that you have plenty of room on top and the bottom. Then with one finger, you poke into the space between the abdominal muscles and through the peritoneum, which is the soft tissue layer that keeps your organs in. Make a hole in that with your finger. Put as many of your grubby grimes as you can in there, you and whoever's helping you with the C-section on both sides, and then you pull. This is like the savage part of the procedure where, yes, both sides are just pulling with all their might to open everything up. Believe it or not, this is the safest and best way to open in this scenario. Anyway, then we stick our hand in there and see which way the uterus is turned, because sometimes it can be turned one way or the other, and we want to make sure we're being really mindful of the vessels that are on the side of the uterus. Some people will then make a little flap so that the bladder comes down because it's very closely approximated to the uterus. So we want it to get down. Some people don't. Then we take a knife and we cut through the bottom of the uterus. Sometimes it takes a couple cuts. It's a lot of layers. Then we, with two hands, one on the top of the uterus and one on the bottom of the incision, open up the incision as wide as we can. You put one hand in, you scoop around baby's head. If they're head down, if they're breech, that's another story. But you pull baby's head up, bring it out of the incision, then somebody, your helper on top, is pushing on mom's soon-to-be not pregnant belly as hard as they can to help push baby out, as the one who's holding the baby helps pull the baby out. Baby comes out, hopefully they're screaming, delayed cord clamping, clamp the cord, bring them over to the RNs. Then placenta comes out, exteriorize the uterus. Usually not everyone does this, but that's when you take the top part of the uterus and you pull it out of the incision that you've made so that you can see really well. You use a lap, you clean inside the uterus top and bottom, and then you sew it up. Sometimes you have to put a second stitch to make sure that there's really no bleeding. You check the tubes and the ovaries, you put the uterus back in, you make sure that there's no blood in the pockets, you check again for the third, fourth, fifth time that your incision is not bleeding, and then you close everything up. You check to make sure that there's no bleeding in your muscles, and you sew up your my daughter just woke up. You sew up your fascia. If there's a lot of adipose tissue, meaning fat, then you approximate that, and then you sew the skin, and then you're done. That's a whole section. Love you, bye.